whatever medicine we use or whichever procedure we introduce, the body has to accept it or to absorb it. For that, some circumstances are necessary. And first step is always the digestion of the things we are using, if it is a medicine. So, when we come to the topic digestion, there we have to understand something about Agni. Agni generally is a fire, it is not a fire that is having outside. It is any factor or any property which is having the functional property of digesting. So, there are different types of Agni in our body. First is to digest the food items we are using, that is the first and foremost one. Then only it will change it to biological form. What we are eat may not be maybe some vegetables or this meat or fish or whatever it may be, that has to be changed to our blood cells or flesh cells or bone, like that. So, a series of reactions are to be taken to make this external thing, which was say vegetable or a coffee or whatever it may be, to our body parts. Different levels are there. The first step is digestion. So, for that, to convert this thing to our body parts, in between there is a series of actions. The first is, when we take one food, it is known as amatvam, that means undigested or not digested form, and then starts the actions. The first level digestion is performed by Jaఠragni, that is situated in the stomach related area, and it is the food items which is reaching in the stomach is getting digested. Then it is turned to Annarasam. Annarasam means digested food particles. Then starts the next level of actions, that this digested things has to get converted to different things. These are known as Dhatus. In short, our body is made up of 7 Dhatus: Rasadhatu, Raktadhatu, then Mamsam, Madas, Asti, Majja, then Shukla. These are the 7 Dhatus. Or the whole body can be divided into these 7 particles. And so, each one is to be get nourished or grown. So, in between there is a step by step nourishment is there. First of all, this Annarasam, which is the final product of digestion inside the this digestive system, then it is converted to the first dhatu, that is Rasadhatu. Then it is converted to the next dhatu, that is Raktadhatu. Then to Mamsadhatu, then to Medadhatu, then to Asti, then Majja, then finally the Shukladhatu. The final outcome of all this action is the Ojas. Ojas means the final capacity of the body, the healthy status or vital capacity, anything can be called. It is the general system, healthy system. And so, in between these 2 dhatus, there is one Agni for changing from one to another. So, there are all these dhatus are concerned with the concerned Agnis. Rasadhatu Agni, Raktadhatu Agni, Medodhatu Agni, like that it goes. So, is this evolution or from changing from one to another also is made, it is coming to practical because of the action of these dhatus. So, the medicinal action of all these procedures depends on the capacity of these Agnis also. So, to maintain these Agnis in normal, some restrictions in the habits or some restrictions in the food items also will be necessary to make it easy, to make it as an easy process. That is why these restrictions are recommended in the treatment procedures.